let's talk about the other hat that you wear, and that's as the owner of the Milwaukee Bucks. You sit on the board of governors for the NBA. Yesterday, the league released a statement, and I'll quote from it. The health and safety of our employees, teams, players, and fans is paramount. We are coordinating with our teams and consulting with the CDC and infectious disease specialists on the coronavirus and continue to monitor the situation closely. It said, they say, no fist bumps or fist bumps over high fives with fans. Avoid taking items such as pens, balls, jerseys to autograph, according to a memo that was obtained by ESPN. On that note, just tell me how you're thinking about this as the owner of the franchise with thousands of fans coming into your building several times a week.
Look, I think it's an issue. I think right now you hope that people who are coming in, I think anybody who remotely doesn't feel well, you hope they're not coming in. I think what you're going to see at these sporting events is, I think you will see a little bit less physical touching among fans. But I think, events are going to dictate what's going to happen. So if all of a sudden, you start seeing fewer and fewer people and there's more and more people getting sick, I think you're going to be forced to be in sort of a situation where you say to people, look, maybe we're going to have the games, which is what they've done in Europe, but you're not going to be able to have fans in there.
They've discussed the fact that you could have events becoming more limited in scope. That those are the words they used, or even canceled. Can you envision a scenario in which some of your games could be canceled?
I don't know if the games will get canceled. I think what you'll do is there'll be fewer people who will be coming to those games, or you may not have individuals who are there. But I think you'll still end up having the games.
You think U.S. athletes are going to travel to Tokyo for the Olympics?
I think it's still a bit early. I mean, the problem is it's 3 months away.
Everyone's waiting to the last minute to decide.
And that's what you've got to do. I mean, if all of a sudden you've got more and more issues, more and more people getting sick, then people are not going to want to go. If you've got less and you sort of feel, okay, you're on the downside, then I think you'll have it.
So paradoxically, we're going to now test more people, which undoubtedly is going to lead to more quote-unquote confirmed cases. People are going to take that as a negative, but the lack of testing doesn't suggest there are less cases. It's just we don't know about them.
You're right, but I don't know if people take it as a negative. If you've got more people who are sick, but from the flu, I think it's 0.01% end up dying. If from here you have 0.05, yeah, that's 5 times more. But then people are going to say, is it worth the risk, right? I think what you have right now is nobody knows what the real amount is, and that's what everybody's worried about.
Would you be willing, if it came to it, to play basketball games with nobody in the stands?
Would I? I'd definitely be there. So I'll be there.
Well, could you envision a scenario in which it gets to that?
I think if the NBA determines that, that could happen. I hope we're a long ways away from that, because that would mean sort of forget basketball. You've got baseball. You've got the season opener, I think, is in about a month for everybody. That's 50,000 people. Basketball is 15 to 20,000 people. So if you're going to do it to basketball, you're going to do it to baseball. You're going to be doing it throughout with all these sporting events. So I don't know. I hope we don't get there.
You guys own the arena as well?
Yes, we do.
Your new building?
Yes, we do.
Concerts, not to mention the political convention the Democrats are holding in the summer.
Yep.
How are you beginning to think about all of that?
Well, I think it's a little bit too early because I think right now people are making a decision, at least for concerts and for games, that it's fine. I'm willing to take that risk because I don't think I haven't really seen a lot of young people getting sick. So, but if you find that you start having more and more people and it's happening because people went to arenas or they went to concerts, I think you'll have less people going and things are going to get canceled.
Are you advising your players, even though they are young and in, as good a physical shape as you could possibly be, are you advising them to do anything differently personally?
Yeah, I think all we're doing is, and I think this sounds a little bit hokey, so I apologize, but that you're constantly, sort of washing your hands, try not to be touching your face, but try to be more focused on who you're touching, what you're touching, to make sure that you try not to get sick.